my name's Bridget. I'm going to be your baby student nurse today. Is it okay if I assess him today, Mom?
Yeah, that's fine.
Alright, awesome. I'm going to check both your wristbands to make sure that they match. Good. Good. Alright. So I'm going to first start with the least invasive. After I look at the baby's general appearance, and the baby is looking really good. Okay, good job. Alright. So I'm just going to be listening to the heart and to the baby's breath sounds. Okay, good. And while I'm at the heart, I'm going to count for a full minute for the apical heart rate, which should be 110 to 160 beats per minute. Okay, 120. Very good. All right, and then I'm also going to note that the baby's respirations are at 40. And then I'm going to be taking the baby's temperature and his axillary, and his temperature should be between 97.7 and 99.5. Good. 98.6. All right. And then I'm going to be looking at the baby's head. I'm going to be looking for any molding and how the fontanelles and suture lines are. I'm going to make sure there's no caput cystatum, which is kind of just like an overall swelling and edema in the head, and it can go over the suture lines. And then if there's any cephalohematoma, which is bleeding in a certain area of the brain, the baby's brain, but it doesn't go like cross over any of the lines. So the baby's good, doesn't have any swelling, and then there's no bruising, and there's no like scratches from birth on the baby's head at all. So now I'm going to be checking out the baby's eyes. So the eyes are symmetrical, they're in line with the ears, they accompany for 1/3 of the baby's face, so they're good, in a good position. There's no extra creases or folds which could indicate either being an Asian child or having Down syndrome. They're not too far down either. There's no bleeding at all, and there's no extra discharge in the eyes. So now I'm going to be testing the baby's nasal patency, and I would don gloves. So I'm just going to be testing his nasal patency by holding down one of the nares and then holding down the other nair. And there are 5 signs that the baby could be into respiratory distress, which is like nasal flaring or swelling, if they have any grunting going on, or if they have like seesaw breathing, something like that. So then I'm going to be going on to the ears to check the ears. I'm going to make sure that they both look the same, symmetrical, good, and then I'm going to be testing the reflex back, the recoil, sorry, caught up for a second. So I'm just going to be testing the recoil of the ears and to make sure they go back into position, which was good. All right, so now I would also don gloves. I'd probably change it again for the mouth. I would just make sure the palate is intact and complete on the top of the mouth. And then I would also check the baby's reflex for sucking on the side and make sure that the baby was sucking, able to do that because that's important for breastfeeding. And then as I move down in my assessment, I'm going to be looking at the baby's neck, and I'm going to be making sure there's no masses on the baby's neck, and making sure that he has good like range of motion, and he seems to be a little bit scared, right? Not scared, but you know, so he has good range of motion, I can tell. And then I'm moving down to the baby's clavicle, making sure that it's intact and good, which it seems to be. I already listened to the baby's belly and heart rate, or heart, so then I'm just going to be moving down to the baby's umbilicus, which is intact. It doesn't seem to have any meconium in it, so the color is good. Doesn't seem to be too dry. Okay, and then while I'm here, I'm going to be noting the baby's, and I'm trying to keep him warm, so I'm just going to keep his shirt kind of tucked over, and I'm going to be just exposing the palms so I can look at the baby's palms and counting that there's 5 fingers on each hand, which it is, and just looking at the creases and the folds, because one crease in the baby's hand can also indicate Downs or an Asian baby as well. All right, so, and then while I'm looking at him, I'm just making sure that there is no, I'm going to be assessing his skin and making sure that he has like a good skin color to him, and not making sure that he's jaundiced. There's like 5 places that the baby would be jaundiced: your forehead, abdomen, thighs, and your eyes, and your chest. And the latest sign would be if the baby was jaundiced in their eyes. So yeah, and I'm just going to make sure the abdomen is good and not like overly rounded or distended. I'm just going to palpate it. Okay, so now I'm going to go down and I'm going to move try to keep the baby as much covered as I can. So I'm going to be checking his private area. Okay, so this baby does appear to be a male, and I'm just going to be checking that his testicles have dropped and that they have moderate rugae on them, and also I'm going to be checking the tip of the penis to make sure the urethra is midline and at the tip, which it seems to be, so that is completely normal. And if I was assessing a female baby, I would be making sure that the labia majora covers up the clitoris and the labia minora. Okay, so then I'm going to cover up that, and I'm going to work my way down and just check out the baby's legs, making sure, again, just assessing the skin. And I'm going to be counting the 10 toes, yeah, 5 toes on each foot, which the baby has, and I'm going to be looking at the creases at the bottom of the baby, just making sure he has enough creases. And then I'm going to be doing the Babinski reflex, and the baby's toes should span out for it to be positive. So, and then I'm going to cover it back up there. And while I still have the baby on this side, I'm also just going to be doing his muscular arm recoil, which, good. So now I'm going to be flipping the baby over. He's being a very, very good baby. And I'm going to be putting him on his belly. And I'm just going to be double checking, taking this off, making sure his spine is in line and that everything's good. I'm going to be looking at the bottom of his spine for dimples and a tuft of hair, because that could indicate spina bifida, which is there's no tuft of hair, so that is a good sign. So then I'm going to be placing him back over. All right, and I am going to be doing the Moro reflex on the baby, which is just testing that he can hear everything. So I'm going to like slap the wall and make sure he went like this, and he seems aware that he heard the sound and that everything's good. I'm going to check the last time the patient or the baby, the last time he voided, and also the last time he had a BM, which was approximately 30 minutes ago. And I'm also going to be making sure I know when the baby is due for his next feeding, which he ate about an hour and a half ago, so he should be eating relatively soon in the next half hour. He's getting a little hungry, and overall the state of the baby is good. He's looking healthy. Yeah.